Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Hello everyone, welcome to today's press conference. I will hand it off to Minister Dominic LeBlanc.
Merci beaucoup, Corinne. Bonjour, good afternoon. This afternoon, I'm joined by my colleagues, Ministers Bill Blair, Patty Hajdu, and Harjit Sajjan. As an Atlantic Canadian, I want to begin by acknowledging this very sad anniversary. 1 year ago, all Canadians witnessed the horrible events in Nova Scotia, and our thoughts are with the families and the victims of these tragic events. From the start of the pandemic, the health and safety of all Canadians has been our government's #1 priority. Today, we remain committed to do whatever it takes to protect and support every Canadian in the fight against COVID-19. The situation in Ontario is evolving quickly, and the increasing numbers of COVID cases are a source of concern to all Canadians. Yesterday, at the Prime Minister's request, I convened a Saturday meeting of the COVID-19 Cabinet Committee. Along with colleagues, we discussed the ways in which we can provide additional emergency support to the people and to the province of Ontario. Comme Patty, Bill et Harjit peuvent vous le dire, nos efforts de coordination fédérale sont considérables et nous ne négligeons aucune piste. C'est un véritable effort d'équipe Canada. Plus tôt aujourd'hui, le Premier ministre Trudeau a annoncé que le gouvernement fédéral travaille avec les premiers ministres des autres provinces et territoires afin de fournir un soutien d'urgence supplémentaire pour lutter contre la pandémie en Ontario. Nous sommes tous Canadiens et les Canadiens savent que nous sommes plus forts lorsque nous travaillons ensemble. And when a neighbor needs help, we help. In the last 48 hours, the Prime Minister has spoken with Premier Fury of Newfoundland and Labrador, Premier King from Prince Edward Island, and Premier Rankin of Nova Scotia. They are all working hard to mobilize what additional healthcare staff may be possible to send to help the province of Ontario. I have also spoken with Premier Higgs of New Brunswick, Premier Silver of Yukon, and Premier Cochrane of the Northwest Territories, and they are also quickly looking at what help might be possible to send to Ontario as well. Our government has offered to cover all of the costs and coordinate the movement of healthcare staff from other provinces to the front lines in Ontario, including using military aircraft to help deliver this help to Ontario. Additionally, the Prime Minister announced that this federal help will also include federal healthcare staff joining the front lines in Ontario as well, boosting rapid testing to help stop the spread of the virus, and working with municipalities to deploy them to hotspots in Ontario. Investing $84.2 million of new funding to support voluntary self-isolation centers across Ontario. These sites have already helped 3,900 Ontarians isolate safely to prevent the spread of the virus. And signing a new bilateral agreement between the Government of Canada and the Government of Ontario to enhance virtual healthcare services in that province. This agreement comes with $46 million of new funding on a virtual healthcare effort across the province of Ontario. Now is not the time to give up. Vaccine shipments surpassed initial delivery schedules by over 50% for the first part of the year. 8 million Canadians have already received their first shot. We'll have over 48 million doses by the end of June and more than 100 million by September. We can do this by sticking together, by continuing to follow local health measures, by checking in on family, friends, and neighbors via telephone or online. As I've often said to Premier Ford and other First Ministers, together we will get through this and beat COVID-19 and beat the third wave. And we stand ready to do whatever it takes to support the people and the province of Ontario. And now we're happy to take your questions. Merci beaucoup.
Nous allons donc procéder à la période de questions. We will now be taking questions. As a reminder, every reporter gets one question and a follow-up. All questions today are on the phone. Opérateur, over to you.
Thank you. Merci. The first question from Mackenzie Gray from CTV News. Please go ahead. Your line is now open.
Hi there. My question's for Mr. Hajdu. I think she's here today. If not, any of the other ministers can take a crack at it. In February, Ontario's own modeling showed that there was going to be a very difficult third wave unless the provincial government took measures that were considerably stronger than what were in the place at the time. Instead, they chose to loosen measures. Do you think the government of Ontario did enough to protect the health and safety of its own citizens?
Thanks, Mackenzie, and it's nice to hear your voice, even if I can't see you. Listen, I think that what has been clear from the beginning, from federal modeling and indeed provincial modeling, is that if we release measures too quickly, that we can see an increased surge of cases. And that's proven to be true in a number of jurisdictions around the world. The challenge, I think, is that, of course, leaders are trying to balance how to have some functionality of normal living while also managing COVID. And I think what all leaders have learned around the world is that it is incredibly difficult to get that balance right. But I think here federally, we have said all along that in order to have a healthy economy, we have to have healthy people. And that's why we've committed to Canadians that we will do whatever it takes for as long as it takes to get our country through this.
As a follow-up?
The provinces that the federal government is asking to help Ontario out have been outstanding examples of how to handle COVID. The rates are low in Atlantic Canada. Now there's been many conversations about potentially diverting vaccinations from some of these provinces and giving them to Ontario because they're hard hit. Why should provinces that have handled COVID well have to bail out Ontario when they did not listen to their own modeling data that showed that things were going to get worse unless they took harder measures?
Perhaps, if I can, it's Dominic. I'll offer a few comments, and Patty can also add her views. I've had an opportunity to speak over the past few days to a number of premiers. And I can tell you that the premiers right across the country are obviously concerned about what's happening in Ontario, and the conversations have been along the lines of what can we do collectively to help. And if you think of a small jurisdiction like the Northwest Territories with limited healthcare resources, Premier Cochrane herself had already begun to ask her health department and the health authorities in the territory, is there anything that we can find to supplement the efforts of healthcare professionals in Ontario? Premier Fury of Newfoundland and Labrador told me his wife, Allison, who herself is a doctor, will be in the contingent of Newfoundlanders and Labradorians that will go to the front lines of COVID in Ontario. The same thing has been true in conversations the Prime Minister had. So I think at a moment like this, the whole country says to itself, what can we do to help the people of Ontario? There are other jurisdictions, and Patty can speak to this, that are also facing significant challenges. But our government's focus from the beginning has always been, what can we do to support Canadians for as long as it takes to get through COVID-19? And obviously our efforts are focused on what healthcare resources we can offer to assist the province of Ontario. And we clearly remain focused on economic measures necessary to help all Canadians get through the pandemic. But Patty, you may have some specific comments as well.
Well, I think you've got it exactly right, Dominic. I think our Prime Minister once said quite famously, a Canadian is a Canadian is a Canadian. And I think that's what the demonstration of provinces and premiers have shown, is that everyone is concerned about Canadians that are struggling, regardless of which province. But let's be clear, it is public health measures that will bring down these curves. Vaccination is very important to save lives, but we also have to stay focused on the public health measures that we know work. And countries and states in the United States are experiencing this exact thing. We can have high rates of vaccination, and we can still see COVID-19 erupt in communities if we don't apply those public health measures while we get to a higher degree of vaccination. You know, Canada's done some extraordinary things. We're now the second most vaccinated country in the G20. And so we've done amazing things together as a country over the last several months. But as Dominic has said, this is not the time to give up. And the fact that we see so much collaboration across Canada from premiers of every province and territory saying, what can I help, is truly, for me, quite heartwarming as a Canadian myself.
We are now ready for the next question. Operator?
Thank you. Merci. The next question is from Jennifer Tagliaro from the Toronto Star. Please go ahead. Your line is now open.
Hi, Ministers. The first question is, I'm wondering if this is in some ways you trying to circumvent Premier Doug Ford and his Ontario government, hearing today that he's threatening to shut down the legislature. And as you know, he pretty much rejected that Red Cross help earlier, saying what we need is more supply, not more resources to administer it. So can you just comment on if you're trying to help Ontarians apart from what the provincial government is doing?
Maybe I can offer a few comments, but my colleague want to add something. Sorry, Patty. From the very beginning, our government has said to all Canadians and obviously to all premiers that we will do whatever we can to support them in any way that's helpful in the fight against COVID-19. We have put in place a series of economic measures. We have adjusted them as we receive better information about what precise elements would be helpful in the fight against COVID-19. We're always open to doing what it takes, as the Prime Minister has said, to support Canadians. So this shouldn't be a surprise to anyone at a difficult time in the province of Ontario, that our government is looking across the government of Canada and working, as Patty said, and as I said, with other provinces and territories to see what collectively we can do to support the province and the people of Ontario. But sorry, Patty, go ahead.
Oh, well, thanks. I just wanted to add to that we've been standing by and helping Ontario since the beginning of the pandemic. And, yesterday I spoke to Minister Elliott, reiterated our commitment to find additional health human resources from federal sources, but of course across the country, to pay for the relocation and indeed any lost wages for those workers who will be coming to Ontario on a voluntary basis, to expand our capacity to expand contact tracing through our federal contact tracers, to help with isolation, although we have a number of isolation sites already up and running, fully paid for by the federal government, 7 indeed, and to make sure that we continue to support the province by deploying rapid tests to municipalities so that they can be used more quickly and with more speed and agility in workplaces to help bring down cases that are related to workplace infections. And of course, she and I have spoken many, many times over the course of the pandemic, and we'll continue to do that work. This is really about making sure that the citizens of Ontario know that the federal government is working well with the province of Ontario to make sure that their loved ones are taken care of, and that we are making sure that there are healthcare resources in place as the province experiences a crisis.
And just to follow up on the supply issue, just apart from the current delays that the province is seeing, there's concern that with expansion to those 18 plus in hotspots, that without additional supply to actually administer the vaccines in those hotspots, the province is going to fall even further behind. So can the minister just comment on whether there is an opportunity to provide the province with more vaccine than was initially planned for this period?
Well, I can give you some numbers that the province has received to date and the numbers that they've administered and what we expect they'll get next week. For Ontario, 4.8 million doses of vaccine delivered to date, 3.8 administered so far, roughly, and 395,000 Pfizer coming this week. We've been transparent with the provinces, including Ontario, about the delivery schedule, even when there are disruptions in the delivery schedule, so that they can continue to plan. I know that they are working, and Minister Elliott referenced this in my conversation yesterday, to try and penetrate more deeply into communities that don't have access to vaccine. I know Minister Blair is working on that as well through a request for assistance of the Red Cross, and maybe I can throw it to you, Minister Blair, to speak a little bit about that.
Thanks very much, Mr. Hajdu. And from the very outset of the pandemic, we've received 68 requests for assistance from provinces right across the country, including 21 from Ontario. And I'll just simply remind us that back even in April of last year, we received requests from Ontario to provide support initially from the Canadian Armed Forces, and then in November to replace those resources with resources from the Canadian Red Cross to help in long-term care facilities. And in total, we actually went into 41 different long-term care facilities with federal resources to help at the request of the province of Ontario. We've also come through with, in response, able to positively respond to Ontario's request for help with temporary foreign workers, and supporting an RFA from Ontario to again provide Canadian Red Cross support to support isolation and recovery efforts. We have been able since January request to provide mobile health units to the province of Ontario. One of them just in my city up at Sunnybrook Hospital is really quite an extraordinary facility. And we heard from the province that they were going to need that. Initially it was to conclude on May, but they've asked us to extend that to the end of June. And we've said yes, of course, because we're here to help and we will always stand by to help. We've provided support for safe voluntary isolation sites, considerable support to First Nations communities in response to Ontario requests. And most recently, on April 10th, the province of Ontario reached out again. And I want to be clear, this was their officials to my officials, indicating that they wanted and required urgent assistance to provide additional resources given the impact of the third wave. And they specifically were asking for the Canadian Red Cross to support the immediate creation of mobile vaccination teams. Our officials are working on that. And ultimately, once we make a determination of capacity, costing, those RFAs move to a process of approval at both levels of orders of government. And it ultimately requires the final request from the province. If they choose to do otherwise, we accept that and understand it. But I want to be very, very clear to all Canadians, we stand ready to help. And we have responded, as I've said, to many, many requests for assistance. We stand by and ready as if Ontario or any province and territory in Canada requires our assistance, we're here to help.
Merci, thank you. We will take the next question. Prochaine question.
Thank you. Merci. The next question is from Mike Lécouteur, Global News. Please go ahead. Your line is now open.
Good afternoon, everyone. From what you're describing, it really sounds like an effort from what we've seen in the past to deal with forest fires. But different from that is that there are specialized people to do that. So how are you choosing healthcare officials? Are they just putting up their hand, or are you at all concerned that you will not have enough people who will volunteer to go help Ontario?
Maybe I can start and then turn to Harj to speak a little bit about the military resources. We are working with the province of Ontario right now to determine what kinds of specialists, what kinds of health human resources are going to be the most appropriate. Of course, it is a volume of nurses and other kinds of specialists that the province is seeking. But again, those conversations are happening between government officials, and I know that the Canadian Armed Forces is also engaged in those conversations. And maybe I can turn to Harj a little bit about some of the specialized teams that he has at his disposal.
No, thanks, Patty, and thanks very much for the question. As you know, the Canadian Armed Forces stood ready to provide Canadian support during this pandemic from day one. And you've seen the history of this. And currently, the Canadian Armed Forces are supporting all across the country. And in terms of supporting for Ontario, we can provide logistic support, which can entail setup of field mobile hospitals as well, and any other logistic support that might be needed, but also medical support. And you've seen this earlier in the long-term care facilities. We have multi-purpose medical assistant teams comprised of 2 nurses and 10 medical technicians that we can deploy, and they can have it can be attached with additional logistic support that can provide a significant impact. They can be deployed quite quickly to any hotspots that they're needed. And when it comes to the transport, we can assist, obviously, as Minister LeBlanc has stated, transporting medical health professionals around the country. And also, we have specialized equipment when it comes to transporting, doing medical evacuation. So we also can assist with that, and we have various types of aircraft to provide in that support, including helicopters. But at the end of the day, we're ready to provide the support. I know our military officials are already well engaged, but at the end of the day, we will do what's necessary to making sure that we're there for Canadians.
Perhaps I can also just add that at the Cabinet COVID committee that was convened yesterday, we received an update from senior federal officials about the ongoing work that has been underway, I think, as Patty Hajdu said, already for a number of weeks, but across federal departments, the Correctional Service of Canada, Veterans Affairs, Indigenous Services Canada, Immigration and Citizenship Canada also have nurses and other medical professionals that may be in a position to offer assistance to Ontario. So that's the work that we're urgently doing across federal departments, and we hope to also be in a position to offer those additional resources if it's helpful to the province of Ontario.
Did you have a follow-up? Okay, we will take the next question. Prochaine question.
Thank you. Merci. The next question is a follow-up question from Mackenzie Gray from CTV News. Please go ahead. Your line's now open.
Hello again. Lucky to get extra questions today. Minister Hajdu, I'd like to ask you about AstraZeneca. It looks like there are many doses that could potentially expire because there's not enough demand from people 55 and up to get the AstraZeneca vaccine, particularly in the GTA. Would you support provinces, particularly Ontario? I know Premier Ford's called for this. Would you support provinces lowering the 55 threshold, even without NACI giving a recommendation to do so?
Minister Hajdu, you are on mute.
I get a rerun here. Thanks, Mackenzie. You'd think I'd know how to unmute by this stage in the pandemic. First of all, to say provinces and territories are free to use AstraZeneca in any age population over 18 as per Health Canada's license for use in Canada. NACI provides recommendations based on the current evidence and evolves their advice as new evidence comes in. In fact, they are reviewing AstraZeneca advice now and will have an update in the near future. But there is nothing stopping the province of Ontario for changing their advice for use to their physicians within Ontario.
I thought you were ignoring me there for a second, Minister, but my follow-up, I guess, is for Minister LeBlanc. If I heard correctly previously, the Prime Minister has yet to speak to Premier Ford about these new measures. Why has the Prime Minister or why hasn't anyone from the government been able to speak with the Premier about this, considering that there seems to be quite a large federal effort to make sure that there's additional help going to the province?
So obviously we have at a number of levels across the Government of Canada ongoing and frequent discussions with counterparts in the province of Ontario. As Patty Hajdu said, she spoke to Minister Elliott, her counterpart, just yesterday in the Government of Ontario. Premier Ford knows, because I've said it to him many times, as has the Prime Minister, but other colleagues with their counterparts in the Ontario government, that the Government of Canada is anxious and willing to do whatever we can to support the people of Ontario and to support the Government of Ontario's efforts in respect to COVID-19. I know that there was, again, today a call between senior officials, deputy ministers at Privy Council office with their counterparts in the Government of Ontario. That took place just a few minutes ago. So there have been ongoing and will continue to be ongoing collaborative conversations about what we can do to assist Ontarians at this difficult moment.
Merci. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from Annie Bergeron-Oliver, CTV National News. Please go ahead. Your line is now open.
Hi there. Thank you very much for taking my question. The other day, the Prime Minister announced that 8 million doses of Pfizer were going to be arriving. These were not initially contracted, and some of them will be arriving in May. I'm wondering what discussions specifically you've had with the premiers about moving up deliveries to Ontario specifically, or diverting some of the vaccines from other provinces to Ontario, which is something that Doug Ford has asked for, specifically around the fact that a number of vaccination clinics in the GTA have closed because of a lack of supply.
So I'll offer a few comments, and Patty or other colleagues can perhaps add something as well. The formula in terms of the allocations of vaccines, the per capita formula, was the unanimous request from all the premiers after considerable work last fall. That was agreed to in December. The good news, as the Prime Minister and Minister Anand shared with Canadians last week, was we were able to secure additional doses, those 8 million Pfizer doses. And as Patty just outlined, there are literally millions more doses coming into Canada over the coming weeks. So we're happy to work with all the provinces to accelerate the delivery, obviously, as best as we can. And so far, we've been quite successful in accelerating the planned deliveries of vaccine doses to Canada. And this work is ongoing. There's never a day that goes by where Anita Anand and other federal officials aren't talking to these pharmaceutical companies to see if we can't accelerate the arrival of these doses in Canada. But the distribution formula that has existed from the beginning was one that we accepted at the suggestion of all the provinces.
Thank you. Since CTV has had more questions, we will take a final question from CBC. Operator, please put CBC on the line.
Thank you. Ashley Burke from CBC National News. Please go ahead. Your line is now open.
Thank you. Minister LeBlanc, it's rare to have a press conference like this on a Sunday. It sounds like Ontario still needs to say yes to accept this help. Do you think that this is going to put pressure on Ontario to accept help from the federal government?
Well, thank you, Ashley, for the question. I'll offer some comments, but Bill Blair and Patty and perhaps Harj can also add something. This, as we've said, is part of an ongoing effort that has existed since the beginning of the pandemic to support provinces and to support Canadians. So at every level across the Government of Canada, obviously out of increasing concern for what we've seen in Ontario over the last number of days, government officials and ministers and the Prime Minister have been doing what work we can to see what additional supports we can provide, particularly in terms of health, human resources. The province of Ontario has talked publicly, and I know Premier Ford has spoken to a number of other premiers with whom we've also spoken about what additional human resources we can offer to the province of Ontario. The healthcare workers, the frontline workers, particularly in the hotspots, but across the province, are exhausted. We've seen in public comments very compelling stories about how healthcare professionals, frontline workers are doing heroic work in difficult circumstances for days and days and days on end. So Canadians are properly saying, what can we do collectively to support Ontarians and our fellow Canadians at this very difficult time? So this is simply a continuation of an effort that the Prime Minister has repeatedly said we will continue to undertake until the pandemic is behind us. But perhaps Patty or Bill, with respect to specific requests from Ontario, can add more information.
Well, I can say that my conversation with Minister Elliott yesterday was very positive, and Minister Elliott was appreciative of the work that we're doing at the federal level to mobilize those health human resources in particular to help out Ontario's hospital surge. I think that she and I have worked very efficiently throughout the pandemic to identify ways that we can help throughout the province. And as I mentioned, we are there. We are present in the province right now. For example, we have 300 federal contact tracers in place. We have 20, they're doing about 2,500 to 3,000 calls a day to people that are close contacts to try and reduce the spread. We have 7 safe voluntary isolation sites in cities across the province, including in Toronto and Peel, Ottawa, Waterloo, and other places. And we're supporting Ontario's testing capacity. We are processing tests in federal labs in Guelph, Ottawa, and the National Microbiology Lab. As you heard from my colleague, an additional $46 million to expand virtual care access to healthcare in the province of Ontario, and of course deployed 11 million rapid tests. So I would say that I think the minister and indeed the premier know that the federal government will be there for Ontarians, and in terms of this recent request, will be there to try and meet their request for additional support to help make sure Ontarians get through this third wave safe together.
And Minister Hajdu, Premier Ford said,
Go ahead, Bill. Please go ahead.
Yes.
Premier Ford's office
if I'm
Minister Blair, we'll let you
I'm
finish.
competing with someone here. Yeah, thanks. If I may just add as well, this really isn't about the relationship between different orders of government. It's about the people of Ontario and Canadians right across this country. We have a collective and shared responsibility to do everything possible to keep Canadians safe. And as we work tirelessly at both orders of government to acquire and distribute vaccines, I want to take the opportunity to remind all Canadians of the importance of following public health guidelines. They work. We took a number of steps in order to slow down the spread of COVID and its variants earlier in Canada. In every place where that has been effectively implemented, we see that it does slow down the illness. I would just take the opportunity to encourage all Canadians, follow those public health guidelines. They're for your protection. And we will, if we work together, we continue to support each other in every way possible. We'll get through these very difficult times and we will get to a better place. But in the interim, we all have a responsibility, and all orders of government have a responsibility to do everything that is necessary to keep Canadians safe.
Okay, Ashley, your follow-up?
Minister Hajdu, Premier Ford's office released a statement today saying that it's waiting for a federal decision on lowering the age limit for AstraZeneca. And in response to the latest cuts in Moderna shipments, the Premier has begun reaching out to European consulates to try and secure more vaccines for Ontario. What do you say in response to this?
Minister, you are on mute again.
Patty, those famous words, you're on mute.
Yes, words that I think some people would have loved to use in my previous jobs. But anyways, listen, we are on national news. So I will just say, listen, thank you for the question. I'll tell you this. We have 48 million additional doses arriving in Q2. And Minister Anand is working, as you know, with the Prime Minister to make sure that we have accelerated doses into this country. The 8 million doses of Pfizer earlier are good news for all of the country, including Ontarians. I'll also say this. In terms of AstraZeneca, Health Canada has licensed AstraZeneca for use for anyone 18 and over. NACI provides advice to provinces and territories. They can adjust their use for AstraZeneca as per their desire and the advice from their own public health authorities and medical expertise. I will also say that NACI continues to review the advice on AstraZeneca use and will have updated guidance in the very near future.
Merci, thank you. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui.